Recording.
Perfect. Great. Hey, thanks, Michael. Good evening. Welcome to the National Public Health Education Week. We are excited. This has been reconfigured for this year, and we're very excited about the opportunities that we're having here. It's always great. It's to showcase the incredible amount of work and outstanding efforts that people have with public health. And public health's all around us. I just went to 2 conferences, and it is just one of the big growth areas, but also the area that so many people are impacted that they oftentimes don't have credit for that. We have 3 major events. You may have seen them up on the slideshow earlier. Tonight, we have a historical perspective of public health here at NYMC. On Wednesday, we have the renowned Carol Levine talking about, with an esteemed panel of aging, public health, caregiving, how important that is, especially nowadays with the changing demographics. And then on Thursday, we're really excited about this. We have a series of roundtables where we have alums from various disciplines within public health and health practice, where we've invited junior high, we've invited high school, we've invited community college and other undergraduate 4-year students to come on campus just to talk to them. And so often public health is a discovery major, and you discover it 2-3 semesters into your undergraduate, and we're trying to get students early to understand that public health is a viable major and one that not only do you learn a lot, but it also is very practical for whatever discipline, whatever major, whatever job you might do. There have been a lot of people, as you can imagine, who've contributed to success. Certainly Cindy Jakubowski, where are you, Cindy? Somewhere here. And Mariage, our retired administrative assistant, she's not here. And certainly our student worker, Kia, where are you? Kia's back there. But I would be remiss not to recognize the amazing work that Jeffrey Patrick. Jeffrey, come on in here for a second. He has arranged this. He's back there. He has organized this with an incredible amount of enthusiasm. He has secured sponsorship. Is it ProDental and WebMD or WestMD are sponsors, and he's thinking bigger for next year, and he will be around next year. It's just been an amazing amount of work. A good administrator hires or finds good people, let them do the work, and backs away. And that's exactly what I did. He's done all the work here. So I've worked with a lot of graduate students in my career. I don't think I've ever worked with somebody who is more aggressive at getting things done. And so nice job, Jeffrey. Thanks for everything that you've done. So I would like to introduce our Dean of the School of Health, Science, and Practice. Dr. Robert Ambler has been serving as Dean and Vice Chancellor or Vice President for Government Affairs for over now 10 years. And he's serving as a great role model, mentor for the faculty and staff here. So the Dean will introduce our guest speakers. So, yeah.
Thank you, and good evening, SHSP and New York Medical College. Greetings, everybody, and let me wish all of us a happy National Public Health Week. Here we are, and I have to say, right here in the almost front row, we have the original team from the Dean's office. Please stand and be recognized. Aline, Lorraine, Donna, and Stefania, and Maureen O'Brien. Please stand with them and be recognized. I thought I was feeling kind of young when he said I've been here for 10 years. It's almost 15, actually. But when I look back at the audience and I seen Lorraine here, I realize I'm not the young one here. You are. You look fantastic, Lorraine. Let's hear it for Lorraine, the original administrator of our school. Original administrator of our school. And going back now 20 years, we're very blessed this evening to have one of our 20-year alumni is here. She came all the way from New Jersey. She went on after her MPH to get a second master's degree in nurse practitioner. Ellen Kaplan, please stand and be recognized. Ellen told me she wasn't sure exactly what she had learned from our vice dean back then, so she decided to come back and give him one more chance. One more chance. Well, truly, Dr. James O'Brien is the father of the spirit of this school. He has been here since almost its very beginnings, certainly when it began to take form, and he really has played the ultimate role in the growth and the development of the school. When I came, he gave me the complete enrichment of everything that had happened up to that point, to the point where on a daily basis, going from the very first day, I felt like I knew the context of things that were happening. In fact, Jim's most famous expression at that time was, well, there's a story that goes with that. He also oversaw the creation of the two other programs in our school, physical therapy and speech language pathology, and the launch successfully of the first online, fully online MPH in the US. And Jim was a major factor behind creating that. He coordinated the launch of the school's Centers of Excellence in Disability and Health, Disaster Medicine, which, by the way, just got another grant from New York, almost $1 million. Nobody knows it yet. We'll announce it officially in a couple of days. Have a good time, Dr. Markinson. It's a raise for you and for everybody at the center. The Center for Long-Term Care Research and Policy, which is now the Center for Long-Term Care, and the Center for Children's Environmental Health. He certainly was a major factor in getting us the original Genesis grant from New York State that ultimately led to the Dana Road building being completely redone and for the launch of the BioInc incubator that now people come from all over New York State and literally from across the oceans to come and see what we've done there. It now has a full-time director. It has 9 or 10 active client firms scurrying behind their cubby holes doing all this research. And one of them already got FDA approval for one of their products, and another one got $22.5 million in venture capital money. Jim got this all started with the Genesis money. There is so much more I could describe, but simply to say that everything from the doctorate in public health program, the affiliations we've had closely with not just the School of Medicine and the School of Basic Medical Sciences, the early work on developing the dental school here on campus in this very building, and the multitude of articulation agreements and affiliations with clinical training sites that our PT and speech programs needed so badly. Jim served on many commissions and committees. Before he came to us, he was Mr. Healthcare in the southern tier of New York, running the HSA in, wasn't it called the southern tier back then? Southern tier based in Binghamton. And he was also our tie to former state senator Jim Talon. Did I say senator or was he assemblyman? Excuse me, sorry. You know, we get a little old here. But he's going to talk this evening about the history of public health at New York Medical College. And I can't wait to find out what he's going to say. So let's put our hands together for our best friend, Jim O'Brien.
Thank you. Thank you very much, Rob. You know, one of the things that As Dean Amler was talking, saying how he listened to all my stories about, what went before. I think that's a key factor or key characteristic that a lot of new people, new leadership, when they come into an organization, have no idea of, and they don't want to hear. They don't want to know anything that went before. They're going to start from scratch. And Dean Amler certainly wasn't like that, but he was able to take that as kind of a baseline and just move the school, the public health programs, light years into the future. And I think we should give Rob a hand for developing and carrying the school to what it is today. I'd also like to thank Dr. Mark Kittleson for giving me the opportunity to reflect on the history and growth of public health at New York Medical. And to be able to share those reflections with you today. Going through documentation and kind of to refresh my memory. And by the way, I want to thank Stefania Bonanni and Vice Dean Ben Watson for retrieving some material for me that was really very helpful. And I thank you for that. So it's, looking back it was nostalgic. I really feel like I'm coming home, even though my parents moved to a new house. But it's still nice to seeing so many familiar faces does make it feel like home. But more importantly, looking back at the history of the school and the public health program has reminded me that the evolution of the public health program and the development of the school have been characterized by both consistency and change. Consistency in that the same core values underlying the program has not only been present throughout, but has grounded and guided organizational and academic development of public health at New York Med. But there's also been change, obviously, and change, if we don't change, the alternative is not that great. But change in that the program and the school have been responsive to, first of all, growth in the knowledge of public health disciplines, student and faculty interests and needs. It's been responsive to best practices as articulated by professional associations, accrediting bodies, the local public health and healthcare communities, by marketplace demands, and of course, as with any organization, by resource availability. It was especially good to reminisce about the people whose talent, commitment, and hard work helped to change, help to really shape the school and guide its development. I certainly remember some really great students and alums such as Ellen, and they have really contributed to the success of the school just by what they would do to enhance its reputation. But the people who that I was able to put more, quite frankly, names and faces together are the people who, the faculty and the staff and the administrators who have contributed so much on really a daily basis. They were the ones who really shaped the program, and anything I was able to accomplish, I certainly could not have done it without them, not even close. So my presentation tonight is going to focus on the organizational and academic developments of public health at New York Med. I thought about, when you're looking at a history, you could do it chronologically, or you could do it by different separate themes, like organization and organizational structure and academic development. The chronology, I discarded that approach right from the beginning, because, I mean, can you imagine anything more boring than standing up there going, well, in 1990, we did this. Then, of course, in 1992, we deleted what we did in 1991 and moved on. So it just doesn't work. The organizational structure and the academic degree programs, they're so intertwined that it can make some separations as we go along, but can't really handle it as like two separate sections of the talk. The history, and I guess, no, okay. Here it is. Okay, the history goes back to let me see if I can get this right, 1980. I know for most of us, history, anything that took place before we got on the scene is ancient history. So for a lot of you here, everything I say tonight will be ancient history. For me, ancient history was what was this period, 1980 to 1990, before I arrived at New York Medical College in the fall of 1990. So at that time, we had approval to offer degrees in public health, an MPH and MS, granted by the New York State Education Department. The degree programs were in 14 different areas, and I'll be saying a little bit about that later. But the administration of the degree programs was kind of a joint effort. It was a joint effort through what was then known as the Graduate School of Health Sciences, and the Graduate School of Health Sciences, and what was then the Department of Community and Preventive Medicine in the medical school. And the Graduate School of Health Sciences, actually, to make matters even more complicated, the school shared a dean. Dr. Charles Ford was dean of both the Graduate School of Health Sciences, but he was also dean of the Graduate School of Basic Medical Sciences. And he was responsible for student issues, including the maintenance and of the catalog of courses, and of course, course scheduling. The Department of Community and Preventive Medicine was chaired in those days by Dr. Joe Cimino. He was a former New York City health commissioner, and it was his department, in conjunction with the dean, that hired most of the faculty for the school and assigned individual faculty members to for different classes. The faculty who were the program directors at that time worked with the dean and with the chair of the department to develop courses and curriculum, and to develop and monitor graduation requirements, all that other good stuff. As far as I could tell, this bifurcated arrangement, while looking good on paper, did not work out in practice. There was not enough, first of all, there were not enough resources allocated to the program. And having one dean trying to run two schools with minimal staff support was problematic, to say the least. add to the mix the fact that the chair of community and preventive medicine reported to and received all of his budget from the School of Medicine. The program directors at that time were except for one, part-time to the public health program. They were full-time in the Department of Community and Preventive Medicine, but part-time to the graduate programs in public health. Other faculty were adjunct to the school. Lines of authority were often blurred, and the admissions function, even which should have been really front and center, that seems to have been split administratively between the dean's office and the Department of Community and Preventive Medicine, and I think maybe even a little bit with the School of Basic Medical Sciences. The leadership of the college, including the Board of Trustees, decided that the Graduate School of Health Sciences, the home of the public health program, should have its own dean. So in 1990, I doing something wrong here. So in 1990, the administration of the Graduate School of Health Sciences was separated from the School of Basic Medical Sciences. A new dean was recruited and appointed, and an administrative structure created for the school. And I'll talk about that in just a moment. But the first dean of the school, the first full-time dean, was Sheila M. Smythe. And she was hired by the Board of Trustees and charged with the task of reorganizing the public health program and creating an appropriate infrastructure to administer it and see to its growth. Dean Smythe had a strong background in corporate management and healthcare. She was a senior advisor to the General Accountability Office, the GAO in Washington. And prior to that, Sheila had been president and chief operating officer of what was then known as Blue Cross and Blue Shield of Greater New York. I was a vice president at Blue Cross and Blue Shield and reported to Sheila up until 1985 when she moved out and went to Washington to work for the GAO. When she decided to take the deanship at New York Medical, she recruited me to come on board to be, at that time, Senior Associate Dean and to assist in administering and further developing the school. Now, the first step was to create an infrastructure for the dean's office. And, we needed to do all those mundane things like purchasing and payroll and all those good things that make everything else possible. And we also had to develop a new admission structure. But so the procedures for recruiting students and processing applications had to be, use the word recreated rather than established. And eventually, new information systems had to be installed. Many people were involved in these earlier efforts, and Dr. Amler introduced them to you earlier. It was Lorraine Toohey as the school's administrator, Donna Clark, Aline Marr, and of course, Stefania Bonani, who later joined the staff of the dean's office. Now, I should point out that I don't know whether we were having a history of this, but as I recall, Aline was originally working for the physical therapy department, and Stefania also was the administrative assistant for physical therapy, and we managed to get them down to the other end of the hall and to the dean's office. But that set a precedent. So the tradition continued with Fiona joining again from physical therapy and coming down to the other side of the building. The admissions functions, we also were very fortunate to have some really good people there. Dale Lynn was the first director of the office, and Assistant Dean Marion McGowan, Irene Bunziak, Pam Sewitt, eventually joined over a period of time and really made the admissions office hum and function very well. And I think, Irene, as I recall, you still stayed with the admissions of people for the physical therapy program. I mean, for the public health program primarily. You know, other people took care of speech and PT. In the early 90s, you know, I don't know why, Mark, we couldn't have used the Center for Interactive Learning. I'm so familiar with that. We had a bunch of program clusters. So one of the things we did early on was to try to organize all these 14-degree programs into manageable units called program clusters. And they were, as you could see, in public and international health, and in there was the program in behavioral sciences and health promotion, general public health, gerontology, international health, and maternal and child health. This what was then known as health services management cluster consisted of correctional health, emergency medical services, and health policy and management. There was also a program in nutrition and in disability and human development, and what we called health quantitative sciences. And that included biostatistics, clinical research administration, epidemiology, environmental health, part of that, and also health informatics. All of these program clusters had full-time directors, program directors. The two exceptions were nutrition, which was headed by Steve Schwartz, who was full-time in the pediatric gastroenterology, and Dr. Ansley Bacon, who was president of the Institute for Human Development. Just so you'll know, the public and international health cluster was headed by Dr. Kathy Falvo. Health services management was headed by our friend Annette Chilfayan. Nutrition, as I said, was headed by Dr. Schwartz, and health quantitative sciences was headed by Dr. Paul Vicentainer. Now, the program directors were responsible they were responsible for directing and serving as chair of those programs. And they were supported by a group of associate program directors who were responsible for sub-programs. And here we remember Dr. Rhea Dornbush, who had originally developed and filed with the state the proposal for an MPH in behavioral sciences and health promotion. And of course, Drs. Denton Brosius and Chu-Hu Shi, who were also sub-program directors in that area, in health quantitative sciences. I should mention, as looking at health quantitative sciences, that going back to some alums and how they helped to enhance our reputation, one of the ways in which some of them did that was by joining the faculty and becoming eventually a program director herself. And refer there to Dr. Maureen Kennedy, who did her master's and I believe, right, the master's and the doctorate in epidemiology. Eventually, while the program clusters functioned essentially as departments, they were, the nomenclature of departments was introduced after Dr. Amler was here for a couple of years. He looked and he said, aren't they really departments? So yeah, they are. So we changed the name and the program directors of the clusters became department chairs. And the newly named departments included health policy and management, environmental health science, behavioral sciences and health promotion, and epidemiology and biostatistics. And of course, the latter two programs were eventually merged into epidemiology and community health. Okay. The health quantitative sciences, then Dr. Paul Vicentena went from program director to chair, and eventually, of course, all of the different public health departments were last spring merged into one department of public health with Dr. Mark Kittleson. As we developed an infrastructure for the school, of course, going along with that is the creation of a number of committees. And the committees were Academic Policy Committee and Appointments and Promotions. Key committee was, and I guess still is, the Curriculum Committee. And other committees included Student Advisory Committee, Research, and Evaluation Committees. But let's go back to the program clusters. I think, yeah, in the public, because what I want to talk about here is the development of the different degrees. Initially, as I said, in 1980, the MPH and MS degrees in a whole bunch of disciplines, 14 different disciplines, was approved by the New York State Education Department. And these included currently offered programs in not quite sure. I think I may need your help, Jeffrey. Well, I skipped over one section here that in 2009, we created, as part of the organizational structure, don't go away. We created, as part of the structure, the Institute of Public Health. And that was created in 2009 and included, it has come to include several centers of excellence. The Center on Disability and Health, the Center on Disaster Medicine, the Center for Long-Term Care Research and Policy, and the Center for Children's Environmental Health of the Hudson Valley. Now, here's where I get back to the programs. You saw this slide, or most of the material on this slide, back when I was talking about program clusters. And these are the master's degree programs that were eventually, that were initially and later developed. The bold on the top one indicates that that's still a degree program that's currently running. But there were other degree programs in general public health, gerontology, international health, both an MPH and an MS, maternal and child health, correctional health, emergency medical services, and health policy, and of course, health policy and management, which is also bolded. It's not moving. Oh, okay. Maybe okay. Biostatistics still exists. Clinical research administration, no longer existing. Epidemiology, environmental health science still exist. But programs in health informatics, disability and human development, and nutrition were discontinued. Before I get into the doctoral degree programs, I just want to say that in terms of these programs, for example, general public health, international, et cetera, they essentially, they got folded into other degree programs. The clinical research administration was discontinued. Health informatics, we both created it, and Dr. Brosius was a big part of this, and that was eventually discontinued. The doctoral programs were originally approved in 3 different areas. They were approved in epidemiology, which was launched but not continued. Health policy and management, which was launched and is currently offered, and behavioral sciences and health promotion, which was not even launched, although it did receive strong approval from the New York State Education Department. In the epidemiology, there were actually a couple of graduates, but eventually it was phased out by our not accepting new students in epidemiology. Now, I think here I want to stress several important factors. One is the decisions to eliminate a degree program were made on the basis of critical mass, both of students and of faculty. Some programs simply did not have enough full-time faculty members, or the members of the full-time faculty, the numbers that we had were deemed insufficient to sustain a program. And that was something that our faculty were very much concerned about, and it also was a big concern of the accrediting body, CEF, the Council on Education for Public Health. The doctoral degree program, as I said, in epidemiology, there was a small number of students, and they were allowed to complete the program. Remaining students, after a program was closed, were either able to transfer to another program, or if they were close to finishing, we were able to allow them to complete the degree in that area. In no case did we, I don't believe, did we leave a student disenfranchised. We were very, very concerned about our obligation to the students and our commitment to them. Some of the certificate programs were basically added because of students still had interest in some of these other areas. So that, for example, a certificate program in emergency preparedness was created. a certificate program in global health was created for those who had an international interest. A certificate program in long-term care and also in public health were created. Before I leave the degree requirements, the degree requirements for an MPH were always either 45 or 46 credits. And this was established right from the beginning in 1980 with the approval of the New York State Education Department. However, there was an important catch to how many credits were required for a degree. Students who had completed an MD degree or were medical students in the joint MD-MPH program were required only to complete 30 credits. In other words, their MD education was deemed in effect to be worth 15 credits. And this was true of a number of schools of public health. The public health faculty, however, eliminated this degree option and said, no, we're not going to grant 15 credits to anybody. The degree is 45 credits. And interestingly, about 10 years later, CEF added that as a program requirement in order to maintain accreditation. But this was a case where we were there ahead of CEF. See where distance ed or off-campus education. Teaching at off-campus, we decided that there were a number of students who, for whatever reason, were unwilling or unable to travel to the Valhalla campus. So we decided to offer classes at Good Samaritan Hospital in Suffern and at Danbury Hospital in Danbury, Connecticut. And that worked for a couple of years. And there was precedent for this. In the late 1980s and early 1990s, the school offered an MS in health management to management employees at Lincoln Hospital. And this was through a contract we had, City Health and Hospitals Corporation. Unfortunately, the Health and Hospitals Corporation decided to pull their funding for that, and the program came to an end. But it did give us an inroad into the what was required to do off-campus instruction. So the question is, how did the two programs at Danbury and Good Samaritan and Suffern work out? Well, we closed them because of a couple of things. One is that students who all of a sudden, or who had initially said, well, they can't cross the Hudson, for example, from Suffern. You know, that was a big barrier. They eventually found the bridge, and they would come over to take courses here in Valhalla. And it made scheduling very difficult, because we'd decide to, okay, we're going to offer healthcare in the U.S. here in the fall, and health economics in the spring, or one of the other cores in the spring. Well, some of the students said, I don't want to wait till spring. That fits my schedule now, so I'm going to come to Valhalla and take the class. Similar things happened with Danbury, but Danbury got a little more interesting. We were told at one point, after we were probably teaching there for a couple of years, we were told by the Connecticut Department of Higher Education that we needed to be certified to teach in Connecticut. So, and we did. We got ourselves certified. Eventually this involved, having to go, and it was at Dean Smythe at the time. She and I had to go to Hartford and testify before a public testimony before the commissioners of higher education. We had to have a site visit at the Danbury site, and of course develop a full report and proposal. And it was really like doing a self-study and having a self-study site visit. The only thing is we wound up with a gap between when we were notified about the need for jumping through some hoops with the state ed department and being able to actually offer the classes at Danbury. So we figured, okay, Danbury is right along Route 84. And we know that for students who live in Connecticut, they could just make it over the border to a facility in New York State. And similarly, we found that a number of the Danbury students actually were New York residents. So one day, Annette Schulfine and I set out to try to see, was there any kind of a facility or institution that would be right around the juncture of 684 and 84, or Route 22 and 84. And there was no hospital there, there was no nursing home, there was no healthcare facility. So we were kind of, we thought, well, we'll give this some thought. So we stopped for lunch. And we stopped for lunch at this, it was kind of a coffee shop associated with a motel right at the juncture of 22 and Route 84. And we went in and had lunch and got talking to the owner. Said, you know, would you, what are your hours? Said, well, you know, we're open for breakfast and for lunch, but usually late afternoon and evening, we're closed. Oh, we thought, well, that's interesting. We need to hold classes late afternoon and evening. So what happened was we wound up using that as a teaching site for probably at least one semester and maybe two. And so, and I noticed that she just left, Dr. Deb Viola actually taught a health economics class in this little coffee shop. And the woman who owned it was very accommodating. In fact, she even walked around and refilled coffee cups during the whole class. And she told us, she said, you know, she says, health economics is very fascinating. She says, I've been sitting in on the classes, kind of in the back of the room, I don't interfere. But, you know, so that was a good, that was an interesting experience. In Suffern, we wound up, which I'll say a little bit more about as we talk about culminating experiences. But we wound up, I taught a course, I think I taught healthcare in the US at the Suffern site. What I also did, this was pre-Amazon days, so I also used to deliver books to Suffern and to Danbury. I'd pull my car up to, you know, the basic science building, load it with a couple of cartons of books, and take it off over there. We used to also, Barbara Wines, who was, you know, so helpful in starting the school and helping us to develop the right policies and procedures. She was the registrar, and she used to go over it sometimes with either Dale Lynn or Marion McGowan and myself for registration. And we would take care of the registration process. Stefania, and you were never involved, right? Eileen, you never came. Did you come up? No, but did you go to one of the off? No, okay. So Barbara decided to give her staff a break, so she would come over every once in a while. We used to also do recruitment there. Eventually, though, both programs were not viable for the reasons I said. But you know, on the other hand, we did get some really fantastic alums out of those programs. You know, because the early students in the off-campus sites tended to be either practitioners or administrative staff at both of the hospitals. And in fact, one of the first classes that I actually taught over there, one of the students wasn't sure why she was even taking the class. She was a pediatrician. And she said, you know, I'm not even sure why I'm here, but yeah, it's interesting. She eventually became health commissioner for Rockland County. And Joan Fussell, right? And so it was really very good. The thing that really did what caused us to really close the off-site classrooms, I guess, was it had more to do with the economics of hospitals and healthcare delivery. The hospitals all of a sudden were starting to, quote, right size, and they laid off a number of employees. But also for those who remained, they were expecting a lot more effort on their part. And some of the people, quite frankly, said, this doesn't, you know, I'd love to continue my studies, but it just can't work because, you know, I'm working 70 hours a week, whatever. So that was probably the main reason why it closed. But we eventually were able to take care of people who were off campus in a bigger, more sophisticated way. We started distance education. And that way we could not only bring in people from the wider region here, we could bring in people from the wider world to study at New York Medical College. We began that program with a pilot study working with the Fordham Graduate School of Social Services. And they were interested in our helping them to do a continuing ed program for social workers in managed care, which managed care was, you could tell it at the time, I mean, managed care was the big new thing on the block for healthcare. So we worked with Fordham to develop distance ed. And I think I have to say, they did provide a lot of the technical assistance and some early instruction in how to do distance education. We did all the teaching. And eventually this led to doing an online degree in health policy and management. And people who were really the pioneers and helped to make all that possible were Assistant Deans Lydia Cavio and Denton Brosius. So that what happened was in 2009, we okay, here it is. 2009, we started the distance education program, and of course that has just grown by leaps and bounds. And my understanding is it grew tremendously also in quality. Relations with the county health departments and with other community organizations have been from the beginning viewed as not just a good idea, but as critical to public health education. From the beginning, the school was advised by its Public Health Practice Council, which consisted of all of the public health commissioners in the region. The Community Advisory Board and the Partnership for a Healthy Population were established in the mid-1990s to facilitate external community relations. And a key person for that is who really helped to shape. She was really, I guess, I don't want to use the term grandmother of community relations, but Dr. Amy Ansell really, now, but. But Dr. Ansell was really instrumental, really, in getting the partnership off the ground, and also the Community Advisory Board. And the partnership was set up as a 301c corporation, and so it existed as a not-for-profit organization. But what's also key, not only was it a focus for our bye Donna. Not only was it a focus for our external relations, community relations, but it also served as the launching pad for the practicum program, because Amy was able to parlay a lot of those contacts into practicum placements. And that's another program that has grown tremendously over the years. Other external involvement took the form of service to public health departments, other county agencies, and healthcare organizations. And these services were rendered by Drs. Markison and Riley with the Center for Disaster Medicine, by Dr. Vicentena, and I think Chuhu is involved in some of this, the statistical services that were rendered to hospitals and public health departments. And also, very key was that assistance was provided to the regional committee of what was known as the Berger Commission. It was a commission looking to right-size hospitals in the region, and that was very much, it was led by Dr. Amler and assisted by Professor Shofayan and Dr. Tahara. And you know, that was also very successful, and I think all of your recommendations were eventually adopted. And also external involvement on the international scene and at the United Nations was developed by the person who also oversaw the Global Health Certificate, and that's Dr. Minnie Murphy. Finally, a word about accreditation. Prior to 1995, the only accreditation that we had was LCME. It was the Liaison Committee for Medical Education. And this is the body that accredited the School of Medicine. And there was a lot of feeling on the part of the leadership of the college at that point that that was enough. we didn't need, what more do we need? We have LCME. Some, however, the fact that we had a president in the early 90s who had an MPH from Columbia, Harry Barrett, thought, you know, no, we really need to do something more than that. So we first applied for Middle States accreditation, which was the regional accrediting body that really it accredits almost all schools and universities in the United States. So we applied for regional accreditation, and after an extensive self-study, it's too bad that Donna left, because I think Donna worked, right? She was really working around the clock on this one. But we applied for regional accreditation by Middle States, and did a self-study, site visit, etc. And we got the initial accreditation in 1995, but then there was reaccreditation by that group in 2001 and 2011. It's interesting to note that even though there was resistance at first to moving, why would we ever need anything more than LCME? Now, LCME can't be granted to a medical school unless it also has regional accreditation. So in pushing for that, we really did them a very big favor. But we also, while we had the Middle States, we then felt that we needed to have accreditation for the public health programs. So in 2000, in I think it was early 2001 or two, we applied for CEF, Council on Education, Public Health accreditation. We did it as a school. We applied to be a school of public health. And we were granted pre-accreditation, and then we eventually did get reaccredited as a school. Why we went for school rather than program at that time, there were a lot of factors, including a push from the leadership and the Board of Trustees, especially. But this was where we first had our name change. So we went from the Graduate School of Health Sciences to the School of Public Health. Later on, after 2006, we decided to reevaluate whether or not we wanted to stay as a school. Basically, we did a strategic plan, and this was under Dr. Amla's leadership. And we looked at two major scenarios. One was to continue as a CEF accredited school of public health, or whether to transition to a CEF accredited program in public health. And in the strategic plan, we projected revenue and expenses as you would in any strategic plan. And we looked carefully at the public health marketplace. Now, underlying the plan were our values, our interest in educating public health practitioners, and say the word practitioner with big, bold letters and underlined. And we were interested in also our developing commitment to branch out beyond public health. So that, for example, looking back in 1995, we launched the physical therapy program, initially as a master's in physical therapy, or an MS in physical therapy, and eventually as a doctor of physical therapy. And we also launched in, I think was it 1999? We launched the program, the degree program, a Master of Science in Speech Language Pathology. So we, being a program really made more sense, both in terms of resources, in terms of our values, and again, the emphasis on educating practitioners, and also our interest in recognizing that we really have 3 program areas. We have public health, but also speech language and physical therapy. So we made that decision, the Board of Trustees approved it, and we went ahead and got accredited. We changed our accreditation to program accreditation. Now, I've mentioned the speech pathology and physical therapy programs, and of course they have their own accreditations, as you well know. Physical therapy has CAPTE, which, help me out, Fiona, it's the Commission on Accreditation for Physical Therapy Education. And the speech pathology had ASHA, which is the accreditation, American Speech Hearing, yeah. Right, thank you. So, and I also, in mentioning physical therapy and speech pathology, I didn't go into any of the history of those programs because, you know, it is Public Health Week, not Physical Therapy Week or Speech Hearing Week. But I think I don't want to in any way understate by that the enormous contributions that the faculties of physical therapy and speech language pathology had in developing the public health program. I mean, all of the surveys that we had, the surveys of alumni and students, course evaluations, handbooks, the policy on academic integrity, review of all the curricula. This was very much carried out by involvement of physical therapy and speech language pathology faculty, both serving on the academic policy committee, the curriculum committee, and some of the other committees. So I want to, and at the time it was Dr. Watson was the first chair of speech language pathology, and for physical therapy we had Drs. Jim Gordon, and later current chair is Dr. Mike Majak. So that concludes the study. I'm sorry that jumping around a little bit with the slides, but I do appreciate your attention, and I would be happy to answer any questions that you might have.
All right, let me turn the lights on. We can see if there are any questions. Nice job.
Thank you.
Really nice. Okay. Questions? Any questions?
We'll see who was sleeping.
That's right.
Okay, if there are no questions, are there any
Comments?
rebuttals or addenda that I missed?
Great.
Okay, I don't want to be standing in the way of everybody
right.
eating.
Appreciate
right? So,
it.
thank you.
We do have food, but before you leave, as part of the sponsorship that Jeffrey has organized, he's gotten some gifts, and so, or he's gotten a door prize. So when you came in, you got 3 or 1 RSVP. You got 3. just showed up like I did. You get one thing.
Oh, look at this.
And Jeffrey, what are they going to receive?
So you're gonna get a Samsung tablet. It's a
All right.
it's actually a bundle that comes with case and all the other HD stuff that goes with it, high tech stuff. And
Stick around, we got some for you. So okay.
we have
Now to honor, you heard that Ben Watson is stepping down as Vice Dean sometime in July. Appreciate all the work that you've done, Dr. Watson. You get September now. Oh, okay. But it keeps dragging on and on. So they don't know what year. But anyway, why don't you do the honor of drawing the winning ticket? If you draw your own, we'll talk
You
about
won't
it.
be surprised.
And if that ticket is not here, we're going to give them 20 seconds.
oh yeah.
Then, because a
20
few people left, and if you don't call your ticket, then we'll draw another one.
One of the other things that I think is consistent is trying to retire. And they keep pushing back months, right, Ben?
Oh, you got one. You got one.
Okay, got the winning.
Number.
It's worth 40 million. No,
Number is 817098.
098. Who's at it?
Yes.
Oh!
No 20 seconds.
Congratulations. So, yeah. We're also, we do have a little something for Dr. O'Brien, and actually, you want to take some pictures with this?
Dr. O'Brien, whoops, not working. Can I borrow your mic? Dr. O'Brien, it's my privilege to announce to everyone that by approval of the Board of Trustees of New York Medical College, you have been designated Vice Dean and Professor Emeritus of New York Medical College. And we present you also with this plaque of appreciation for your lecture on the history of public health at New York Medical College, National Public Health Week 2019. Fiona will help me present the Emeritus certificate. Fiona?
You don't want to let go, huh? No, here, we'll both hold it.
Okay. And Jeffrey, can you step in for a photo of this with your plaque?
Whoa.
Thank you. Now,
Thank you.
all right. So before we go, I told you guys that RSVP was super important to the function, and we wanted to get the word out. And right here we have a 6-month prescription to audio books, where you get 3 books for 6 months for the first person who RSVP, and that would be Akriti Gogaredi.
Hey. Congratulations. Yeah. Hey. Thank you. Thank you very much for showing up to the first of 3 events. This has been really good. I like history, and I thought this was very interesting. Wednesday? Except you're ineligible. But thanks for doing this. Jeffrey, again, nice job with everything. He has even bigger ideas for next year, so this will be interesting. So thank you very much.